All right, great. Well, we might make a slow start as people are joining. So hello again, everyone. I'm Jessica Hicks, Director at the World Hepatitis Alliance, and I'm really delighted to be chairing today's webinar, We're Not Waiting, Beating Hepatitis and Cancer Together. So we can move to the next slide. Great, and on to the next one, because before I go any further, I want to let everyone know that translation is available in today's webinar. So if you have a look at this screenshot here down the bottom of your screen, you should be able to see an interpretation sign. And if you please select the language that you require, either I think it should be French or Spanish should be showing us the options for you. And then today's webinar will be fully simultaneously translated. So the theme of World Hepatitis Day this year is We're Not Waiting. And it's an opportunity to really celebrate the actions individuals take in their own lives every day to protect themselves from the impact of hepatitis. And that could include getting tested, vaccinated, or starting treatment as recommended. And it's also a time to celebrate the incredible organizations around the world who aren't waiting and who are working tirelessly to eliminate hepatitis in their communities. And I can see a number of you have already joined and sort of putting who you are and where you're from in the chat. So I'd encourage everyone to please do that. And this is our second World Hepatitis Day webinar. So if you didn't get the chance to attend our community forum on Tuesday, I would really recommend that you try and watch the recording. I think our team will put the link in the chat because we really got to hear from so many incredible and inspiring people living with viral hepatitis who are definitely not waiting and who are taking action to raise awareness and support others living with hepatitis also. But today, we're going to be focusing on the links between hepatitis and liver cancer and why integrating the two is critical to hepatitis elimination efforts. So this is the agenda for today. You're going to hear from each of our panelists. And then at the end, we will have time for a Q&A. So if you have questions as people are speaking, please put them in the Q&A box down the bottom of the Zoom panel. But we'll also have the opportunity at the end, if you raise your hand, we can unmute you and you can ask your question directly. So I'm now going to ask our incredible panel to introduce themselves. So starting as I see you, Devin.
Good day, everyone. It's a pleasure to be here with you. My name is Devin Razavi-Shearer, and I'm the Associate Director of Hepatitis B and Delta at the Center for Disease Analysis Foundation, which houses the Polaris Observatory.
Great, thank you. Wendy?
Hi, everyone. It's my honor to having me here, and I'm working for Taiwan Liver Disease Prevention and Treatment Research Foundation. I'm the Deputy Director. Thank you.
Great, thanks for joining. Milan?
Thank you very much, Jessica, first of all, for the invitation. It's my pleasure to be today. My name is Milan Mišković. I'm a board director from European Liver Patient Association.
Great. Nafisa?
Hello, everyone. Really good to be here and part of this really great panel. I'm Nafisa Chotan, program lead for endemic and neglected tropical diseases at the Africa Centers for Disease Control and Prevention, which is based in Addis Ababa, Ethiopia. Thank you.
Great, thank you. And Rosie?
Hi, everyone, and thank you very much for the opportunity to join. My name is Rosie Tasker. I'm the Global Advocacy Manager at the Union for International Cancer Control, based in Geneva.
Great, thank you all. So to start us off today, I'm just going to very briefly sort of highlight some of the links between hepatitis and liver cancer and why we wanted to use World Hepatitis Day this year to spotlight this issue. So viral hepatitis is the most common risk factor for liver cancer. Chronic viral hepatitis can cause damage to the liver, which can lead to cellular carcinoma, also known as HCC. And that accounts for 80% of all liver cancer cases and is the third most common cause of cancer deaths worldwide. And if we move to the next slide, please. So in fact, currently 54% of all liver cancer cases are caused by hepatitis B. And people living with hepatitis B and hepatitis C are at far greater risk of developing liver cancer than those that do not. And what is very concerning is the number of liver cancer cases caused by hepatitis C is predicted to increase and potentially double in the next 10 to 20 years. But despite this, recent research that the Alliance has conducted has found that only 42% of people globally, 42% of people globally are not aware that hepatitis is one of the leading causes of liver cancer. Whereas we know for other cancers, the link between the cancer and the cause is well understood. So, we know that smoking can lead to lung cancer. And Devin later on today is going to share some new data that they have on the comparison between the cause of smoking and lung cancer and hepatitis and liver cancer and how they're quite comparable. We also know that the HPV vaccine is used to prevent cervical cancer, but the hepatitis B vaccine, which was actually the first cancer prevention vaccine, the links between hepatitis B vaccine and liver cancer are still not well known. So if we can move to the next slide, to improve health outcomes, we really need to raise awareness on the link between hepatitis and liver cancer. But beyond that, we also need to ensure that hepatitis prevention and care is part of liver cancer prevention strategies, because increased vaccination, screening, and treatment for hepatitis B can prevent the disease from progressing to liver cancer. Hepatitis C treatment prevents long-term damage and reduces the risk of developing liver cancer. And so it's critical that people living with hepatitis are continuously monitored for liver cancer and other liver diseases, as that can lead to early detection and treatment and ultimately improve their health outcomes. And this is really reflected as well in the updated version of the World Health Organization's non-communicable disease best buys document. And it sets out cost-effective policy solutions for countries to manage non-communicable diseases. And the hepatitis B vaccination for liver cancer prevention is now listed as a best buy, and this is really important. And I think as a community, we all need to be advocating to ensure that governments are including this in their cancer prevention strategies. But beyond that, I think we also want to ensure that future NCD best buys document includes hepatitis treatment and testing as cancer prevention as well. And so this is, I think, a very brief snapshot, because I really want to give time for our speakers to dive into sort of how other organizations and regions are approaching better integration between hepatitis and liver cancer, because this really does have the potential to save millions of lives. And that's why we're here, for the people living with viral hepatitis and liver cancer. And so before I hand to our first speaker, we're going to play a pre-recorded video from Ibrahim Agaya, who is a WHA member based in Senegal, and who has kindly agreed to share his story with us today. So if I can hand it over to the tech team.
Being told when you have a chronic disease such as chronic hepatitis B, generate legitimate concern in the patient. I am in a good position to talk about this myself, being a chronic carrier of HPV followed by a co-infection with the Delta virus. Good day to all. My name is Ibrahim Gueye from Senegal. Born in 1964, I was nicknamed the malaria patient at a very young age, and my parents often called on a traditional healer who excelled in the treatment of yellow fever to treat my illness. However, the problem was never solved. I was in ignorance, and my health ended up deteriorating over time to the fact that I was diagnosed late. It was only in 2010 that I knew the real cause of my suffering. Following a long illness, I was diagnosed with hepatitis B. The paraclinical examination that followed confirmed that I was indeed suffering from active chronic hepatitis B. In 2011, a third liver test revealed a co-infection with HTV, and this was the summum of the challenge, as I had to face a very rigorous follow-up with more frequent tests and very expensive treatment. I was physically, morally, and financially devastated. From 2011 to 2015, I was exhausted by repeated checkup and examination, blood test, ultrasound, scanner, fibroscan, viral load. I was exhausted by a treatment with side effects and interferon for 48 weeks, renewed 3 times. I was suffocating from 2 loans taken out from my employer and the bank, in addition to the sale of my house and personal vehicle to cover my medical expenses. I was the victim of stigmatization in the workplace twice. After a few years of follow-up, treatments and assessment, I was finally diagnosed with cancer, which required chemioembolization in 2016. This stopped the cancer for progressing. Then in December 2021, I was able to benefit from a liver transplant in Egypt, following a liver organ donation from my eldest daughter, Ngonege. May Allah bless her. Amen. This operation was expensive, as it has to include the cost of transplant, medical expenses, and all the expenses such as transportation, accommodation, and stay for 3 people, patient, donor, and accompanying person. After the liver transplant, which was very successful, I am no longer a carrier of HPS, G, and HDV, and my cancer is cured now. Therefore, I consider that fighting for oneself and for others who are victims of the same pathology allows one to overcome his own suffering, his own illness, and to fully assume his own destiny. I was able to overcome my fear, to take charge of my disease by creating an association, Suffer Hepatitis, to fight effectively against this infection, which changed the life of thousands of people a day. Informing people about the disease, which can easily be prevented by vaccination, about existing treatments that give good result if the diagnosis is not made too late, about progress in research, particularly in the therapeutic field, guiding patients in their medical and social pathways, listening to and answering the question of patients and their family. These are the key issues in my involvement in the association that have made me founding president of Suffer Hepatitis, honorary president of Suffer Hepatitis, member of the board of director of ALPA and AFHE, member of WHE. Many thanks to all the people who have accompanied me in this fight, and particularly to my daughter, Ngone, life donor, to my family, to Professor Moussa Seydi and Pape Saliou Mbaye from Senegal, to Professor Gamal Sheha and Abdou Wahab from Egypt. Thanks also to Dr. Rosie from WHO and all the members of WHA. Thanks finally to the Minister of Health and Social Action, Abdoulaye Diouf, to the Minister, Cheikh Tidiane Gadio, and to the President of Senegal, His Excellency Macky Sall.
Great. Thank you so much, Ibrahima, for sharing your story and really reminding us why we're here and what we're all fighting for. So now I'm going to hand over to Rosie to speak on the UICC perspective on advocacy in the cancer space.
Fantastic. Thank you so much for that, Jess. And I think it was so excellent to hear from Ibrahima to put a much more sort of human face to some fairly significant figures. And I think I wanted to sort of kick off the contribution from UICC by sort of stepping back a little bit. Hepatitis vaccination and HPV vaccination, as Jess mentioned, are a really core part of the prevention work that many cancer organisations, including UICC, undertake. And I think one of the reasons why it's so exciting to us and why opportunities like this are so valuable is because cancer, like hepatitis, is a complex set of diseases. And given the growing burden globally, the opportunity to be able to put a lot of this to bed, to stop it early, is such a fantastic one when we think about those kind of long-term lifetime impacts that are going to have on patients, on their families, and on communities. So UICC's work to date has really focused on the hepatitis B vaccination as a key kind of strategy for reducing the burden of not only liver cancers, but also gallbladder, pancreatic, and kidney cancers, which has growing body of evidence. And as I said, this has been a long-standing part of the work that UICC has been doing. So in 2011, the UICC community got together and created something that we called the World Cancer Declaration, which has really sort of driven and guided our advocacy to date. And a core part of that, one of the things that our member organisations asked us to do, is put in there a goal to ensure universal coverage of hepatitis B and HPV vaccines, international vaccine schedules, and to UHC benefit packages. And we've really tried to take that forward and make sure that wherever we can and wherever the UICC voice can push this, we integrate it. So we've seen it in the 2017 Cancer Resolution, which actively asks member states to promote and increase access to HPV vaccination. We've tried to include this in our advocacy around the UN high-level meeting, and we've seen some great language in the most recent political declaration, which talks about vaccinations for non-communicable diseases. We've seen it in the Global Action Plan on vaccines. We've seen it in a growing number of maternal and child health documents. So I think that body is really a testament to how, when we work together across kind of health communities, we can really start to drive the advocacy agenda. And Jess sort of touched on one of the key wins for us recently, and that's the inclusion of the hepatitis B vaccine in the NCD best buys. Not only is it included, it's included as a highly cost-effective intervention. And I think we can't underestimate how good a platform that is for some joint advocacy forwards. And our advocacy work is really guided by the evidence, and the evidence on HPV vaccination is pretty clear, it's pretty irrefutable. So how are we trying to take this forward? Well, UICC works with our member organisations around the world on a number of different pieces, and there's one that I wanted to sort of pick up, which is the work being done with the International Cancer Control Partnership. So the ICCP, for short, helps provide technical guidance and technical advice to governments around the world who are developing their national cancer control plans. We're undergoing a review of the plans at the moment, but one that we did in 2018 has some really interesting data, which says that only 50% of national cancer control plans and NCD strategies actually include hepatitis B vaccination. Now that varies quite significantly. In Southeast Asia, it's only 48% of countries compared to 36% in Tahoe, across the Americas, and 64% in WIPRO. And I think there are sort of two reasons behind that. The first is, in some countries, we've already seen the excellent integration of Hep B vaccination. so it won't necessarily be mentioned in these strategies, but I think it also gives us an indication about how much further there is to take this work forward. And one thing I wanted to share is within the cancer community, we see opportunities like this with a real sense of optimism. Hepatitis B and HPV vaccine are places where we really want to work with other organisations to help drive things forward. And actually, we see it as a place where we can start to make some really excellent progress. So when we're thinking about how to engage, if you're interested in engaging with the cancer community, there's a few quick things that I wanted to flag. The first is, much like the hepatitis community, the cancer community is defined by its heterogeneity. There are so many different organisations, from patient groups to researchers, to professional society, to disease and stage-specific organisations. But what really unites us is a really strong focus on trying to drive evidence-based and patient-focused, patient-led advocacy to really put in place the public health systems and the specific kind of clinical systems that we need to try and address some of those inequities. And I think one of the things we've really learned over the last few years is how valuable that kind of diversity of voice is, that the ability to bring forward stories like Ibrahima's with the data that Devin's going to be running through a little bit later is incredibly powerful. And while not everyone within the cancer community is going to be as engaged in the HEP conversation, I'd really like to encourage HEP organisations to think about reaching out to cancer organisations in your countries, because we do have that great kind of common and shared agenda. Our Venn diagram definitely has quite a lot of crossover in the middle. And thinking about that and thinking about the We're Not Waiting campaign, I think there's a couple of key opportunities that we'd really appreciate working with the HEP community on. And I think that first one is probably looking at what's being termed the grand catch-up post-COVID-19. And for the cancer community in particular, we've seen fairly concerning drops in the coverage of hepatitis B vaccination and also HPV. And this is something we're really trying to work with our member organisations and other organisations around the world to try and accelerate some of that progress. We're also looking at what are the opportunities around things like the negotiations for a WHO pandemic preparedness accord. You know, what opportunities do we have in that to really try and safeguard and enshrine those kind of key interventions? And the second thing I want to flag, mindful of time and not wishing to run over too early in the conversation, is picking up on what Jess said about hepatitis to us, despite being a non-communicable disease, is a key part of the NCD agenda as well. And one thing that we've seen is the inclusion of HEP vaccination in the best buys, but also just to put on everyone's radar that in 2025, we're going to have a high-level meeting on NCDs, which is really going to be looking to map that future direction. And it would be so valuable to be able to kind of engage with different HEP actors to really try and push for the inclusion of key measures for the management of hepatitis as a risk factor for not only cancers, but I understand there's also links with cardiovascular diseases. So I'll stop there. Hopefully it's a little bit of a resume about how we've been engaging, but so delighted to be part of the conversation and really happy to take any questions.
Thank you so much, Rosie. And I just really loved when you said sort of when we work together across communities, we can make huge impact. And I think that's exactly what we're trying to do today. So we're delighted to have you join us from the cancer community. And I think you had some really great calls to action for next steps that we can do. And hopefully we'll have some time in the discussion to dive into those a little bit further. But now I'm going to move over to Devin, and I think Rosie and I have both alluded to some of the great work that you're doing. So I'm not going to give you too much of an introduction because I think many of us are familiar with the work of CDA Foundation and very much looking forward to hearing some of the latest data that you've been working on.
Vamos ahora a oír a
hepatitis and liver cancer.
Devin Razavi-Shearer de la
Sorry,
Fundación del Centro para Análisis de Enfermedades.
Hopefully that's over to you now, Devin.
Muy bien, Devin. Ya hemos hablado de tu trabajo.
Thank you so much. And thank you everyone once again. It's a pleasure to be here.
Una vez más, es un placer estar acá.
Sorry. Ben or Tajinder, could one of you please mute the Spanish translator? Devin, do you want to try again?
Yeah, that sounds great.
Vamos a
Oh,
probar de
nope,
nuevo.
sorry, we're
¿no?
still having some technical problems here.
Ajá.
Sorry, can we please get this translation muted? It's coming through on the English feed.
Hi, Carmen. I'm not sure if you can hear me. It's just needs to switch to the Spanish channel rather than the English channel, I think, because it's overlapping on Devin's words. Thanks, Carmen.
What about now?
No, that's the English channel still.
That's the English channel. Es que I had a, well, let's have Spanish. We'll just continue with Sylvia, and then maybe you can put me again in the interpretation. I think I lost the function because I had a outage.
That sounds
Okay.
great. If you
I'll
can,
try and sort it
Okay.
on my end.
Okay,
Thank-
thank you.
Thanks all. Well, you know, we lasted almost half an hour without a technical problem. So Devin, we'll try this again.
Certainly. So once again, thank you all for being here. My name is Devin Razavi-Shearer. And what I really want to highlight, which is great with what Jess and what Rosie have been talking about, is for too long we've been talking about viral hepatitis as a liver disease. And I think the only way we're really going to be able to eliminate is by focusing and getting the messaging out that it is actually, we're trying to prevent cancer. Next slide, please. So just very basically, for those who don't know us, CDA Foundation is a nonprofit organization, and we work with countries and territories to help reach hepatitis elimination targets. We also are advocates of expanding treatment eligibility, as well as timely birth dose and other interventions. Next slide, please. As Jess was talking about with HPV, we really have a serious marketing problem. And I mean this both literally and figuratively, because if we look at the past, so I'm based in the United States, and if I look at the FDA package inserts for the HPV vaccine, cancer is mentioned 53 times within that insert. So they really are hammering that this is a cancer prevention. When we look at a hepatitis B, there's not one mention in any of the 3 monovalent vaccines that are available for us in the US. There's not one mention of cancer. It's just, oh, it prevents hepatitis B, which is great. But this is part of our issue, is that people aren't understanding the connection between viral hepatitis and liver cancer. Next slide, please. So one thing we decided to look at is, we know that most people in the world understand that smoking is a large risk for lung cancer. So what we wanted to do is say, okay, let's look at all of the largest cohorts regarding smokers and look at those for viral hepatitis, specifically those for individuals that will go on to progress to HCC, so liver cancer. And what we found is that of the adjusted hazard ratio, the risk of smoking, so someone who currently smokes 1 pack a day and someone who has hepatitis B, is almost the same, as well as with hepatitis C. So you see there, those bars are the confidence intervals. So there's actually overlapping with the confidence intervals, showing that the risk of cancer from smoking is extremely comparable to the risk of cancer from viral hepatitis. Next slide. Another way, of course, to look at these risks are not the adjusted hazard ratios, but the odds ratio as well. And so looking at the odds ratio, actually the risk of developing liver cancer from hepatitis B or C is 4 to 8 times higher than the risk of smoking 1 pack a day. Now we do get pushback from this, because some people say that we are diminishing the risk of smoking. But really what we're trying to show is that we've been diminishing the risk of cancer from viral hepatitis. Next slide, please. So how does this play out, especially with people like Ibrahim that we were so lucky to hear from earlier? You know, each one of these numbers is someone with a family, with lives, with dreams, and that are extremely productive members of our society. And so if we look at where we believe things are going, is that we are going to see increases in HCC through 2030. So we'll go from about 852,000 to over 1 million by 2030. A much larger increase of hepatitis B related HCC, so a 33% increase versus Hep C related, which is 6%. And it's important to note that the hepatitis B increases, it's really a result of people who were infected prior to the implementation of vaccination. So we know that the average age of liver cancer development is in the 50s, about 54, 55. For most of the world, it is a lot lower in Africa, about 42, but it takes a long time for these people to progress. So we're still seeing the impacts of people who were infected prior to vaccination. Next slide, please. Now, of course, there are significant disparities. So this top graph is showing by income group the rates of HCC. So per 100,000, really trying to adjust this. And high income countries will see the largest decrease, which is 29%, whereas upper middle income countries will be increasing by 13%. Now, what's interesting to see on the bottom left for the hepatitis C rates is that the only group by income group that we expect to meet the 2030 target for Hep C of 2 is high income groups. And you see that line is decreasing, and that's really a result of treatment. Also on the lower middle income group, this green line, I want to highlight that you can see the impact of Egypt's elimination plan because they completely offset the trajectory. But once, with other countries not picking up more slack, there still will be an increase. And unfortunately for hepatitis B, we don't expect any of the income groups to be meeting the target of 4 per 100,000 by 2030. Next slide, please. So we really focused on liver cancer, but as been alluded to, of course, there is other cancers associated with viral hepatitis. So we wanted to at least mention some of these as well. And the really points that I want to drive home is that hepatitis B and C cause cancer. Hepatitis B vaccination is cancer prevention and an extremely cheap cancer prevention and effective of that. And treatment of hepatitis C and hepatitis B is cancer prevention. I look forward to your questions, your comments, and to hopefully working together to eliminate hepatitis in the future. Thank you.
Great, thank you so much, Homi. It's really interesting data and sort of the idea of comparing it to smoking. I just love that because I think it really actually reframes how we're thinking about how dangerous hepatitis is in relation to progressing to liver cancer. So I'm going to hand over now to Nafisa, and she's going to speak about Africa CDC's work in viral hepatitis elimination and liver cancer prevention on the continent. Thank you, Nafisa.
Thank you, Jessica, and thank you, Devin. Really compelling data, I think. And really, yes, I think there's a lot that we can do to really improve definitely our messaging and really, use that data to make our messages, I think, more compelling. And I think we always talk about this. How do we package information so that it's even, we talk about data, but even how to make it, more understandable or like, easier to digest by your Minister of Finance, etc. And these are data that, are so compelling that I think would really make, a big difference by adding it to the discussions when we reaching out to ministers of health and ministers of finance and saying, this is clear, this is, these are the links, and, we need to do something about it, right? If we are doing something against, smoking, we should be doing something against hepatitis B. And, there are so many, easily accessible treatments, but also, as you said, it's a vaccine preventable disease, so there's no reason why, this should not be the case. Sorry, I'm going off on a tangent. My topic is not this, but this was so exciting. I felt I just had to quickly comment on this. Okay, I think that's probably a minute gone from my time, so 6 minutes left. All right, I'll try to be as brief as possible, but really just to say, it's really good to hear from everyone and everything that's been said, really moving testimony from Ibrahima. And I think that really reminded me that, this is why, we're doing this. And this is why, we need to keep doing this work, every single day until we eliminate, this disease from the continent and globally as well. And as Africa CDC, we've just really started working in this space on hepatitis, but already as we're starting work on endemic diseases, hepatitis was one of our flagship programs from the very beginning. And for us, what we really do is support implementation of key documents, including the Cairo Declaration for Viral Hepatitis Elimination in Africa, which has been endorsed by all 55 heads of states and government of the African continent. So very quickly, I want to highlight a few key activities that we're already doing together with, some of you who are here on the call. In particular, I'm looking at Jess here. So our activities really are, aligned with what we call the new public health order for Africa. And really what we are saying is that, post-COVID-19, there are some lessons that we've learned from the pandemic. And really, how do we ensure that, we're applying these lessons for, for sustainability? How are we ensuring that, as a continent, we become really self-reliant? So one of the things we're looking at is workforce development. And workforce development, I think in the context of hepatitis, is not just, regarding diagnosis, and treatment, but really long-term management of our patients as well. Because even as we have a cure, for example, for hepatitis C, there are people who will not be able to benefit from it. They have progressed, to a certain extent. They still need to be managed, right? They still have cirrhosis that needs to be managed. Some of them have progressed to liver cancer, and they still need to be managed. So really, how do we ensure that, we are managing all our clients, if I can put it that way, across the continuum of care? So this is some of the work that we are doing together with the Ministry of Health of Egypt, Ministry of Health and Population of Egypt, really supporting training for some countries that, we're sort of piloting this training, and I'll perhaps give more details, next year when we have some more concrete, I think, results. But right now, what we're trying to do is really look at bringing multi-sectoral teams from each country to look at the model that Egypt has put in place and that has worked for them. And once, we bring them, to Egypt, looking at what they've done, develop a sort of roadmap to see how to support implementation of a viral hepatitis elimination program in country, but also combine it with hepatitis B. So, what we're trying to, we're going stepwise. We're trying to say, okay, we start with C, but as we're screening people, can we screen them, for Hep B as well? And as we're doing Hep B, can we screen them for other things, So really, I think, it's an opportunity to really bring, or, sort of bring care across the board to people that have not generally been, or do not necessarily access healthcare system as readily. And I'm thinking about, about men such as, Ibrahima that we've seen today, that do not necessarily access, healthcare systems on a regular basis, but that are at the most risk of developing, liver cancer down the line from hepatitis B and hepatitis C. We're also working with a group called HepsaNet, and this is really trying to get the best available data for the continent so that we can develop recommendations for the continent. And this really came out from discussions about how, some of our existing guidelines do not necessarily apply to our populations, on the continent. And there is a need to really make sure that as we're talking about management of patients, we're really looking at guidelines that are as simple as possible. And we really want to say this, simple as possible, because right now they are extremely complex, especially for, resource limited settings. Really looking at guidelines that take into consideration the context of our patients here on the continent. So, and looking at what tests are already available that can already be used to really classify the care of these patients. And also, just to mention very quickly, of course, we receive requests from different member states on training. And as these requests come in sort of ad hoc, if, for example, Senegal is sending in a request for training for their healthcare workforce, we also support with that. So for us, it's not just us going to member states, it's really a relationship that we develop with them if there is a need. And there is something that, member states are already setting up in terms of programs for elimination, for training, etc. We are ready to support them with that. I want to touch briefly on the component of local manufacturing and pool procurement, which I think is really key to unlocking, access to treatment for all. And this is where, Jess is part of, the team that we're working with the African Medical Supplies Platform, really trying to say what commodities can be purchased, at bulk for the continent, right? To really drive prices down so that countries can access them. And these are conversations we've also had with the CDA Foundation, just to really understand, how, and I think, in fact, this was something that was brought by the CDA Foundation, the pool procurement model, so pool purchasing model. So really, we're trying to see now this AMSP platform, the African Medical Supplies Platform, was set up for COVID, but how do we leverage on this existing platform to ensure that now we bring commodities, diagnostics, therapeutics for hepatitis B and hepatitis C, so that they are accessible to all our member states at an affordable price. And what's interesting is that they don't necessarily include, commodities that are WHO pre-qualified. They also include commodities that have been validated by other agencies, such as the FDA and the EMA. And the third component I'll touch on is really looking at strengthening our institutions and not just looking at, service delivery, but looking at program managers. And that's where I mentioned when countries come and say, we really need support with training across the board, for our medical doctors, because we need the doctors to be able to diagnose patients, On the continent, I think that's one of the key. There are so many issues, but I think the key thing is also, some of our doctors do not know how to diagnose our patients, or by the time they do it, they've already progressed really, to the stage of cancer. I remember very vividly an 18-year-old patient, in South Africa who had been, going from doctor to doctor until he reached the tertiary hospital where I was affiliated and where, he was diagnosed with terminal liver cancer. And his only risk was hepatitis B infection. He did not smoke. Sorry, Devin, but yes, he did not smoke in this case, and he did not drink. The only thing he had was hepatitis B infection. And he died at the age of 18. So, these are, again, real stories that you always have, you always think about when you're doing this work and saying, when, the going gets tough, there's a reason why you're doing this. And, we really need to keep working. I'll lastly talk about domestic financing, which is, I think, a very key component, really trying to get governments to invest. And I think this is data like the CDA Foundation has presented here, that can really build a case for governments to invest in their workforce, because we must not forget that as we're talking about hepatitis B, what we've seen on the African continent is that liver cancer from hepatitis B, from hepatitis C, tends to develop in men that are breadwinners in their 40s, in their early 50s, where there's still, as you said, economic so I use the term, Devin, that I cannot exactly remember now, but they are contributing, to the socioeconomic landscape of the country. They are, breadwinners for their families. And I think we've seen too many stories where, they get diagnosed very late and finally, they end up, dying of liver cancer. And this could have been preventable, with a vaccine at the very beginning. So just touching on that, and we are having an extraordinary summit for health next year. We don't have the dates yet, but this is something that we're working on. And one of the key things we're going to be talking about is the Cairo Declaration for Viral Hepatitis, in Africa, when really looking at, renewing the commitments that were already made for, some of these diseases, not just hepatitis B, but also NCDs. So it's really, I think, key. And I think this, this webinar is really timely because we can think about linking the two and making that link very clear for our heads of state so that, they can really see that we are losing, members of our active workforce, for this disease that could be prevented with a simple vaccine and simple treatment that would cost, nothing compared to treating liver cancer, down the line. And yeah, lastly, just, talking about some of the relationships we've developed over the years. And again, with CDA Foundation, with WHA, we're trying to bring different partners, CGHE as well. When we're talking with, platforms like EMSP, we ensure like, we try to bring as many stakeholders as possible so that they can contribute to the conversation. And so that, we can make sure that we are all speaking the same language. So, and, WHO is also part of our external technical advisory committee, because we really want, the voice of, the people. We really want the voice of, different people working in this area to tell us, whether we're on the right track on, some of our strategies and activities that we've planned. And this is how, we really ensure that the work at Africa CDC is aligned with the most pressing priorities and the most pressing needs on the continent. Thank you, guys. Thank you, everyone.
Great. Thank you so much, Nafisa. You did the work that Africa CDC is doing is incredible. The Alliance is very pleased to be partnering with you on some of that, but Africa is disproportionately burdened, and it's great that Africa CDC are really taking a lead in helping to address that. So before I introduce our next speaker, I just want to remind everyone, please do put your questions in the Q&A. I think maybe there are some questions going in the chat, but there's a lot in the chat, which is brilliant, but it means that we may not be able to grab every question out of there. So if you put it in the Q&A, we can make sure that we get to them in the discussion. So now I'm going to hand over to Milan to discuss ELPA's patient advocacy across the European cancer landscape and some of the work they've been doing with cancer preventing vaccines. Thanks, Milan.
Thank you very much, Jessica. I'm delighted to be today with all of these excellent speakers and excellent organization who are presenting today, and also all the present participants who are somehow, let's say, friends of the liver or hepatitis friends. How you mentioned, I'm coming from European Liver Patient Association. How I will describe the work of ELPA, especially the past couple of years in the past. We know that we have a lot of, let's say, challenges to fight with hepatitis around the world, but also on the international scene, we saw that it's very difficult. We can, let's say, open the systems to accept the process of elimination. We know that exists a lot of different kind of recommendations, declarations, every kind of paper who are launched somehow to contribute in this process of elimination. Somehow, in a lot of countries, was not recognized this process, fortunately. ELPA start to analyze and to discuss among the members inside first. And we saw, in the time of COVID, we saw a huge challenge for us, and also in the same time, a hope. Let's say, when a lot of services stopped to run in the moment when COVID started, we saw that a lot of different diseases will raise. And one of them was also the liver cancer. And when we start to discuss about the liver cancer, not was so keen the liver community to accept the challenge that we need a little bit to go to the non-communicable diseases. I'm so proud to say that ELPA was one of the first organizations in Europe, also in the world, who start to connecting this, let's say, two subjects somehow. And what was coming on the carpet in Europe, let's say, which opened the door somehow for us in Europe. That was that Europe, for the first time, especially European Commission and institutions, speaking a lot about health and the health issues. One of the things which we use, like ELPA, how become one idea to realization, is that hepatitis. We realized that one of the most hepatitis is one of the most explicit, let's say, risk factor for liver cancer. We decide to let's say, to engage with our stakeholders, different stakeholders from the cancer community, from the old partners, like let's say, VHPV board, who is working on this, let's say, field a lot of years and strengthening the national systems around Europe. we decided to tackle the question
I think we have maybe lost Milan there. So what we might do is we'll go to you, Wendy, and then we will come back to Milan. Hopefully he'll be able to reconnect. So Wendy, if you wouldn't mind, you're going to be discussing viral hepatitis elimination in Taiwan and the impacts of that on liver cancer. So I will hand over to you. Milan, you're back online.
Oh, sorry, something happened with my network. Sorry, I'm here. Sorry, I didn't know what happened. Sorry.
All right,
sorry.
No problem. We'll let you carry on then, and then
Okay.
we'll come to you, Wendy, after.
Sorry, I don't know where I stopped, but I will say that the biggest challenge for us, like European Liver Patient Association, was to tackle with our main stakeholders and partners from European cancer societies, scientific societies, and all our partners in Europe, how to approach hepatitis B and C to the next EU cancer beating plan, which was planning to be launched. And we find a way how to approach, let's say, this open question. But the open question is not just to be, let's say, once more time addressed, just to be addressed. We were expecting much more from the European Cancer Beating Plan, and it's happening in the moment. Why it's happening? I will say that the EU Cancer Plan takes a comprehensive approach to the cancer prevention and control, including these various risks. Hepatitis is one of them. By addressing these interrelated factors, the European plan aims to reduce the burden of cancer and to improve the overall health outcomes of the European citizen. We saw a huge, let's say, importance for us, like liver community, that the European Cancer Plan recognize the importance of tackling the viral hepatitis, like one of the main cases of liver cancer. It emphasized the need of prevention, early detection, and the treatment of hepatitis B and C. The plan also aims to improve vaccination rates, improving screening and testing, and to ensure access to appropriate different hepatitis treatments. What is most important for us? Implementation of this European Cancer Plan can make countries eligible for different kind of financial support programs. The European Union provides directly financial resources, research collaborations, and technical assistance to all member states and to the countries who are seeking support for the implementation of the cancer control initiatives. What is very important, they need to harmonize with the EU Cancer Plan. And also this is also somehow open access also for the countries who are trying to approach to the European Union and Commission. And all of these activities help us somehow connect it together and open the space to have something which was very difficult to be successful in the moment. That is mean we have some kind of funding. We open space for the member states, also for the liver community, together working with the scientific community with different kind of funding resources, which is one of the best success, I think, in Europe, what is going on in the moment. This communication between European institution and the liver community completely changing the landscape in Europe. And we need to use this and to improve the situation, because how everything started before the COVID and a lot of activities was ongoing with the global strategy for elimination and the European Action Plan for elimination. We saw that, first of all, was a big, let's say, optimism that the European countries and Europe, like a continent, is going to be among the first continents who will make the elimination process. But in the reality, it was not like that, fortunately, because Europe is so diverse. This is one of the biggest, let's say, challenges who exist in the moment. but European institution through the EU cancer beating plan, EU for Health program, different kind of EU approaches in the health, even has different initiatives like EU Health Union, which is for the first time they like, let's say, approach the health on another level. European Liver Patient Association is tackling from all of these sites, this institution. It's part of all of these institutions, I must say. We are part of European Commission, European Cancer Beating Plan, ECDC, European Medical Agency, HERA, all important agencies and bodies in the moment what exist in Europe, which I hope so will provide us let's say, very soon with very serious input in our work in Europe, and the work with our stakeholder, which we are providing together with the scientific community, like ISEL, like VHPB, all other our partners which are coming in from Europe, giving really, I think, a good example maybe for the other parts of the world how to unite and to make some difference. Maybe in the future. I hope so this example will be follow and lead from other side with the other continents. And what is for us very important, like European Liver Patient Association, and that World Hepatitis Alliance was among the first our partners who accept this challenge and to make this connection with the liver cancer and also CDA, which we have excellent collaboration. And I must say that especially a couple of years with all of you, I don't like anymore to mention, but the collaboration is what it's opening the doors. And I think that the patient voice is going to be more stronger and more applicable for the different kind of health authorities among the world. Let's give us a space and possibilities together with World Hepatitis Alliance to eliminate viral hepatitis really to 2030 in some part of the world, who's going to be, let's say, leading forces for the other systems.
Great. Thank you, Milan. And I think, Europe is an incredible example of the power of partnerships in really getting viral hepatitis and liver cancer into that EU beating cancer plan, which is a huge step forward. I'd like
to mention, I forget, for the first time in the history, we have so many projects dedicated dedicated for the liver disease, not just for hepatitis, but for liver disease, approved from the European institution. It's amazing how they like to do something. We will fight more to get in the future, and the collaboration is, let's say, staying on the table for all of us to have more, let's say, initiative together to done in the future.
That's great. And hopefully we can dive into a little bit more on how you've achieved all that in the discussion. But for now, I'll hand over to Wendy, who's our final speaker for today, and then we'll have some time for discussion.
Hi, everyone. I would like to share my slides with you. And yes, can you see this?
Yes.
Well, it's my honor to join this webinar that we can fight hepatitis together. My name is Wendy Wong. Seems I cannot move my slides. Okay, then. Okay, my name is Wendy Wong, and I'm from Liver Disease Prevention Treatment Research Foundation in Taiwan, and we are the NGO as well. And I would like to share with you our viral hepatitis immunization experience in Taiwan, and give a little bit flavor of the disease status in Taiwan. Actually, liver disease is the most serious disease in Taiwan, and our HCC death rate is the #1 in the cancer category. As we want to see that we want to kill the HCC, then we have to kill from the very beginning. We have to kill hepatitis B and C. So this is what we are doing now. And actually, Taiwan is the first country who started the HPV vaccination in newborns. The program started from 1986. So now is it make a tremendous impact to our age under 40 years old, and under the leadership of our Professor Song. And Professor Song, together with Professor Song, together with our Professor Shi, they established our foundation in 1994. And ever since then, the mission is to widely spread of our liver disease awareness, and also the start with the blood screening. And of course, the medical innovation is following. And as you can see that in the last 29 years, we have started more than 800 session of the free blood screening of hepatitis B and C. You can see that most of the area are the remote area, and for also those areas that the lack of the medical resources the most, and those people need our help the most. The concept is, if you cannot come to us, then we will go to you in front of your doors, and then we'll try to get everything to cure, to test, to try to find it out. And we also have our toll-free hotline for our people, start from 1995, 9 to 9, Monday to Sunday, for those people that they are willing to understand more about liver disease, so they can get all the informations. And we're not only cure their physically, we also trying to make them totally, after the treatment, they're healthy like ordinary people. So we encourage them to climb the mountains, to run the marathon. And then we have a patient supporting group. So when they are sadness, they have happy, they have questions, they have someone to talk to, they have someone to discuss. So they're not alone. And we also have a lot of educational brochures, including hepatitis B and C and HCC, also magazines. And nowadays, the social media, we also have the Facebook, Line group, and YouTube. And our doctors, they also go to the radio to have the broadcast program regularly. And we're not only educate adults, we also educate young people. And why? Because the age under 40, they are mostly vaccination covered. The critical age, the critical age of HCC people are age 45 to 80. So the reason why we educate young people is we are leveraging their parentinghood and grandparentinghood, their relationship, to make them to bonding with their parents and ask them to come forward to test hepatitis or have the treatment. So we had this program starting in 2014, and we also recognized by our government last year. We won the Asia and Taiwan Sustainability Action Award for this program. And I think we try to make them as an ambassador of their health, the family health. And in the last 30 years, we have done a lot of blood screening. And as we know that liver is a silent organ. It will not shout, it will not cry when it's damaged or it's suffered. So what we're going to do in the next 10 years, what is the next action we should do? And we're advocating once ultrasound every year to detect your liver is healthy or not. I will urge you to close your eyes for 1 second and to think, when was your last abdominal ultrasound performed? And you reflect yourself. And ultrasound is a non-invasive and most efficient, or cannot say most efficient, but a convenient tool to detect if you have liver, a tumor or cancer or other diseases yet. And we start advocating once ultrasound every year, start from 2021. And then, as you can see, that's from 21 and 23 and this year, starting last Saturday. And simultaneously start 8:30 in the morning and start until the 11:30 in the morning. Totally, we have benefiting 4,600 people of the ultrasound examination. And turns out the abnormality rate is 81%. So this is a terrifying numbers. And of course, the government is very appreciate our program. Then we also win an award of this program. And what we have achieved, we used to say that our HCC is #1 death in the cancer category, but now you drop to #2. And actually HCC incident rate is from #1 to #4. The death of chronic disease, actually liver disease and liver cirrhosis is usually is #6. Now we're dropped to #11. And I think this is a tremendous result. And actually start from last year, our government initiate free of charge from age 45 to 79, the people that they can eligible to have one hepatitis B and C checked for free. And for Aboriginal people that they down the age down to 40 to 79. And this is previously people they have to pay by themselves. This is the reason why our organization start carrying on this testing for our people. And together, actually, Taiwan is aimed to eliminate Hep C in 2025, and we are 5 years ahead of WHO. And I'm sure then together we're here today, then we can achieve our goal in with a no hepatitis world very soon. Thank you.
Thank you so much, Wendy. That is incredible. It's really fantastic to see the leadership that Taiwan has shown in addressing hepatitis and reducing liver cancer rates, and the role that civil society organizations have had to play in that. And actually, so now we're going to open it up to some Q&A, and that leads us very nicely into the first question in the chat, actually, who's from Teresa, and she's new in her role as a Hep CNS and has volunteered to run the World Hepatitis Day stall tomorrow in her trust. And she'd appreciate any tips that will help pass the message across as it's her first time. And so Wendy, Milan, especially as such strong advocates yourselves, maybe you could answer this question first. Sort of, what's been your experience in terms of getting the message across effectively?
I will say Wendy first, please, because.
Thank you. Actually, we have, of course, we have media exposure. We have this last Saturday event. Then we have large social media exposure, and then we're asking each one of our members or volunteers. They will post the information in their Facebook. Actually, Facebook is very individual and yet is very broad. Is a very broad platform to get this information out. So this is what we're trying to do. And then we also discussed, we were trying to cooperate with the enterprises like 7-Eleven, like Family Mart. This is the reason why we would like to cooperate with them, and then because they have a lot of different locations in over Taiwan. So this is the next step. We would like to cooperate with them.
Great. Milan, did you have any thoughts?
Yeah, I will share my experience, my personal experience from my national work in this case. Different kind of approaches, depends what kind of tool you have or what you can use like a resource. From guerrilla actions you can do till different kind of media approaches, sending press releases, different social media campaigns, even including, if you know, some from the celebrities. In this campaign, I'm using this methodology, different kind of events, supports, public persons who are public speaking persons, not depends what kind, not matter what they are, but they are famous in some field. We are using in our, let's say, different campaigns. Everything can be somehow, let's say, with a synergy between the things. What I know that it's very difficult sometimes to have enough resources to make an excellent campaign, but you can approach from different angles. I will recommend you, depends if you are a volunteer, different leaflets outside of some of important, let's say, health institution. Asking them, you have a million of different approaches, which from the beginning, which I was doing till today. Now, let's say somehow I become a public person in my country with this public media, press conferences and everything what is going on. But everything is also, I was using what the World Hepatitis Alliance offering on the websites, the messages, and I'm translating them. European Liver Patient Association giving me a lot of tools and resources also in the same time, support. I'm asking people from VHA, from ELPA to give us, let's say, somehow video messages or something like that, which I'm disseminated to my health authorities, letters, manifestos, everything. You can do a million of things.
Great, thank you. So obviously, if anyone of our other panelists have any suggestions, I think feel free to put it in the chat. So we do have quite a few questions and I want to try and get through them all. And also, if anyone that's listening in today would like to put their hand up and unmute yourself and ask your question in person, please do. And we'll call on you. But for now, we've got another question in the chat, which is, what is your opinion on how to increase the willingness to uptake of Hep B vaccination amongst adults when the vaccines are available in health centers, but out of pocket cost for that? And as a follow-up, what things should be considered by the policymakers to address that issue? Devin, do you want to, I know you, CDAs had some in-country programs dealing with sort of some of these issues.
Certainly. So, of course, we agree with the catch-up campaign. So adult immunization is extremely important. One thing we never want to forget, though, is that many countries still have yet to introduce timely birth dose. And since the risk of developing chronic hepatitis B decreases with age, it is important to make sure that we are capturing those infants as well, taking the strong lead that we've seen, as Wendy was speaking of, Taiwan being one of the first and golden examples of doing infant vaccination and catch-up campaigns to really eliminate it. But in order to really get the government and finance everyone to be on the same board, it really takes different strategies almost in every country, which is not the easy answer, but you need to find out what drives them and then go on those points. So for some people, it will be cancer and death. That's what they're worried about. So if you focus on that and how it'll fix it, that's good. Others, it's cost, which for vaccination is easy because it's cheap, but they still want to see those sorts of analyses. So really working with each country and ministry on their own to understand what drives their decision-making and what you can do to help support that decision-making.
Great. Nafisa, did you want to add something to that?
Yeah, no, really just to agree, really with what Devin has said. And also just to say that, as we're talking about adults, we must not forget they also include some, key populations. I'm not sure I like the term key populations, but, some specific groups we want to say, that are at higher risk. And there's, I think, just a way of talking to them. And I think bringing in the conversation about cancer, in my opinion, in my personal experience, talking to men who didn't even know what hepatitis was to begin with, just starting that conversation around what hepatitis is and what it can cause later on. And I've found for women, it's a bit easier because, when you talk to them and you say, which is true, if if you don't get tested, you don't know your status, if you're not vaccinated, you are at risk of infecting your baby. These are things that, then they realize, oh, it goes beyond me. It also affects, people around me. So I think this is also, part of the conversation. But again, I think, what I found that's interesting is that in countries, they might even have policies for testing, not just testing, but for vaccinating, for example, healthcare workers, but they don't necessarily do it. And that's a big group of people that, we really need to make sure at least are aware of their status and are vaccinated. And this is I believe, we have at Africa CDC, the Saving Lives and Livelihoods program, which again was focused on COVID, but now we're trying to see and how to include, the vaccines that healthcare workers should be receiving, but are not necessarily receiving. In theory, yes, they should be getting them, but in practice, how many of us have actually been vaccinated when we've joined, the healthcare workforce. In some countries, it will be everyone. I definitely got vaccinated when I joined, the lab and, when I started working there, but it's not the case for everyone. So that's also, some of the target groups. So I think, in every country, there's perhaps an entry point, whether it's your healthcare worker, whether it's a specific group of people that are easier to target. And then from that experience, you can build on that, to access, other groups of people and look at vaccination. But again, to reiterate what Devin has said, let's not forget that one of the key interventions to break cycles of transmission remains the birth dose vaccine within 24 hours of birth. Yeah, thank you.
Great, thank you. Do any of the other panelists want to comment on this at all? Otherwise, we have some more questions that I can get to. Great, so, we've obviously, and I think rightfully, been speaking a lot about vaccination. But, as Devin pointed out in his presentation, there is a very large cohort of people who missed vaccination, who are living with viral hepatitis, and treatment is prevention. So my question to everyone, and maybe I'll start with you, Rosie, from the cancer perspective, how do we better get treatment as prevention into some of these high-level documents that we have managed to do so well with vaccination?
It's a really good question. And I think there are definitely kind of other areas and other disease areas that we could kind of look to. So we've been sort of using cervical cancer and a human papillomavirus as kind of a parallel. I think it's partly sort of engaging with other networks to kind of recognize that actually unmanaged disease does pose that kind of cascade of further effects. And I think a large part of it is also then, as Devin was saying, it's and Wendy and the rest of the panel was saying, it's sitting down and talking to your key champions within governments and kind of getting them to understand that, by making an investment early to stop a disease from progressing, not only are you making a hopefully smaller investment in comparison to the management of liver cancer, which can be quite complicated, you're also returning people to the workforce. You're also not pulling out further family members who may provide care. And so we see this kind of cascade, and that's a key piece that we've seen with like cervical cancer elimination efforts, breast cancer early detection, and the same with childhood cancer. So I think there's definitely a piece around kind of wrapping it and considering it within the full health system. So that would be my suggestion, but delighted to hear from the rest of the panel.
Great. Anyone else on the panel have any thoughts on that? Nafisa?
Yes, thank you. And thank you for the excellent intervention. I think for myself, what I just want to add is, if I look at the Cairo Declaration, for example, it includes, a component on treatment and making sure that treatment is accessible to all, irrespective of, I would say irrespective of HIV status, because as we know, if you're co-infected with HIV, you have a HIV, HBV co-infection, you're going to get your treatment for free. But if you're mono-infected, likely you'll have to pay, and not just pay, you'll probably have to come in at the, a centralized hospital to get your meds, right? And this is, from experience, what we've found is that if you have to ask someone to choose, between coming in monthly and spending a whole day, perhaps, at a centralized facility to get their meds, versus, and these are people perhaps, get paid on a daily basis, which means that if they have to lose one day of work, it means that, and I had, patients tell me, they said, trying to call them to get them to come in, for simple things like, simple for me, for an ultrasound. And they will say, if I come now, I will lose my job and I will die tomorrow, right, of hunger. But this disease, it might kill me, down the line, 10, 20 years down the line. But if I don't work today, I will die tomorrow. So, these are very hard things to hear, but it also makes us realize that we are not making it easy. For, even in countries, I think, where the treatment is available and is approved for mono-infected patients, we're not making it easy for them to access, the medication. So for me, when I'm looking at, yes, we're getting it into these high-level documents, which is great. it starts there, of course, and we keep reminding our politicians that you've endorsed this document, you've really, you've really signed off on this document, but how do we work towards, implementation? And I think there are, some very, I don't want to say simple, but there are some key things that can be done, regarding integration with existing facilities and decentralizing services so that they become accessible to all. Thank you.
Thank you. I think that's a really important point because, it is really important to get, hepatitis prevention, vaccination, testing, treatment into these high-level documents, but it's more important that they're then implemented at the national level, and that implementation and the programs around it are designed in collaboration with people living with viral hepatitis to make sure that they actually are serving the needs. And, as you say, everyone has complex needs and different priorities, and programs need to sort of reflect that, and we need to treat people where they are, not expect them to come to us. So treatment as prevention will only work if it's designed in a way that suits the people that require that treatment. Does anyone else on the panel want to comment on this? I know sort of in Taiwan, Wendy, you've done a really excellent job in getting that political will. And we've had another question around sort of pushing for hepatitis B and C to be included in national health insurance schemes. So it'd be great to understand in Taiwan how the hepatitis treatment is funded and how you achieved that sort of political will to get commitment to eliminate by 2025.
Actually, we work really hard to push ourselves and governments. Actually, in our foundation, we urge that everyone need to have active screening. We have three slogans: active screening, seek medical attention, and early treatment. This is only three major steps that can avoid you from the hepatitis and cirrhosis, and at the end of the day will be HCC will happen. So this is the reason why we keep on urging ourselves and our government, and we're saying that the mission is not accomplished, and we still need to fight, keep on fighting, and we hope that we can achieve the goal of eliminate Hep C in Taiwan in 2025. So this is keep our finger crossed.
We all have our fingers crossed. I think it's great. And Milan, maybe, Europe has shown great political will and sort of maybe some of the advocacy behind achieving that.
In the moment, yes, we have some political will to do some more in the process of elimination through the EU cancer beating plan, of course. This is, let's say, the best tool in the moment, which we have it in Europe, which we need to use it. I hope so that we will use it. And this communication giving, let's say, enough space for the future to change completely the landscape, not just for hepatitis, but for all liver cancer, of course, all cancers in Europe. Connecting like a risk factors, I see also a question there, what link has been made between a HPV vaccine and hepatitis? Both hepatitis and HPV is coming from communicable site who are producing what? Not communicable disease, cirrhosis and cancers. And this is the things which we provide to the European Commission and the scientific community and all our stakeholders and partners, trying to convince them that the policy decision makers, whatever we will do connected with the cancer, if they like to reduce, especially if we speak about the liver cancer, don't forget to mention that we're speaking something which is preventable. Liver cancer is one of the most preventable cancers. If you see hepatitis, if you see enough of the MASH or muscle, now the new names, or how it's going to be, and alcohol, the three risk factors. Let's say liver cancer really is one of the most preventable. But with the latest data of GlobalCan, we saw that the bi-mortality is on the third on the world. That means that something is wrong, even with the lifestyle, with vaccination, immunizations, with access to the treatments and everything. That need to change completely, let's say, the picture which we are doing with the policy decision makers in Europe. Now we have the best option, liver cancer, most preventable thing. For the first time in the history of the medicine, we have a cure for hepatitis C, and I hope so that is going to be something and for hepatitis B also. But we have the immunization process, which is clear. Also, the coverage in Europe, it's 1990, depends of the universal coverage access is 95%. That's mean we can achieve a lot of things in the next period if we unite our voice. This is very important, and I expect the collaboration between the big organizations like World Hepatitis Alliance, CDA, like experts, the scientific community, VHPB board, for all this, let's say, somehow stakeholders were working on this field with the cancer society and to speak in one voice to reduce in the future the liver cancer.
Great,
And
thank you.
hepatitis. Now I say liver cancer, but hepatitis. Sorry, sorry, because I'm very useful. It's very useful for me in my country because I speak a lot liver cancer, and the people, when you mention word cancer, they like to listen us. They like to listen us. I must be honest.
And I think that's a really good point around sort of using cancer to reframe some of the conversation, because I think we don't always get a lot of interest when we speak about hepatitis, but as you say, when we mention cancer, people do pay more attention. Wendy, did you want?
Don't forget, we are struggling with another issue, which is the anti-vaccine movements.
Yeah, that's very true. Sorry, Wendy, did you want to say something?
Yes, and I agree with Milan, and because the cancer people did die from cancer, so cancer is really important. So on top of the vaccination and screening, trust me, ultrasound can help. Trust me, ultrasound can help.
Great. So unfortunately, we are very close to running out of time, and I want to give all our panelists 30 seconds for some closing thoughts, and then I'll close for today. So maybe I'll start with Devin.
Certainly, thank you all. It has been an honor to be on this panel and all the wonderful questions and participation from everyone. I think this is a great step forward because I really think we are at the tipping point of starting to discuss viral hepatitis as cancer, and as that we need to prevent cancer through viral hepatitis prevention, treatment as prevention, so on and so forth. And I'm really happy and grateful to be part of this work with you all. So thank you. I look forward to fighting to expand access and everything else we need to do to reach these elimination targets side by side with you all. Thank you.
Great. Thank you, Rosie.
Very similar to Devin. I think thank you so much for the opportunity to come and listen to you all and speak to you all. And I think the key thing that I've kind of taken away from this is that we have an awful lot of peers and colleagues that we can work with over the coming years when it comes to really kind of rolling that out and sort of driving change nationally and regionally. There's a lot that we can do around integration. There's a lot that we can do in terms of that implementation. So knowing the HEP community is there and you know, actively wants to help us, and we actively want to help you is a great start for a collaboration.
Thank you. We're really looking forward to continuing to work with you and build on this. Nafisa?
Thank you, Jess. And thank you, everyone. Really excellent conversations. I don't know how the time flew, really. It was really good. I think, you know, I'll schedule one-on-one with everyone just to continue the conversation. But one thing I just wanted to highlight, I think, you know, as we're talking about, you know, I think I find that a lot of the discussions was, you know, on a high level, not a lot, but even in the comments, high level, you know, advocacy, etc. I just want to remind everyone that it's our role, each and every one of us, to do the advocacy. You can advocate, you know, for your family members. You can advocate for, you know, your friend who's pregnant to get her child vaccinated at birth. This is advocacy, you know, at grassroots level, and I'm more likely to listen to someone that I trust rather than, you know, the government. And you're talking about the anti-vaccination movement, it's true. But, you know, if I trust, you know, my friend and she's telling me about this, and there's a risk about cancer that I did not know about, of course, you know, I'm going to be more likely to get my child vaccinated and try to do it within 24 hours of birth. So advocacy starts at every single level. So everyone, we must all try to do our part. Let's not wait, you know, for everyone else to, you know, to do it. We can ourselves do it with the people around us, even if we are not part of a formal organization, for example. And I just want to quickly, just to mention, I saw a question regarding South Sudan in the question box. But very quickly, just to say that we are working with the Ministry of Health of South Sudan, actually, and they are one of the countries that we're taking to Egypt next month to start, really supporting them with implementing a program for Hep C and Hep B elimination in country. Yeah. Thank you. Thank you very much for the opportunity. Thank you.
Thank you. Wendy?
Okay, to eliminate hepatitis, I think the active screening is first. The second is the seeking for medical attention. The third is go treatment if necessary. And if unfortunately deliver serious HCC, or you're not feeling very well, or the blood test is not shows anything, go ultrasound. Trust me, go ultrasound really help.
Great, thank you. And Milan?
I will say one thing, if you like to achieve elimination, the elimination goal, all important stakeholders need to see like equal partners. This is very important. Multidisciplinary equal partners.
Brilliant, thank you. And so I just want to use this last minute. I'm going to try and wrap this up because I'm sure everyone has meetings. This is a very busy week. To thank all our speakers and thank you all for joining us today. This is really just the first, I think, of many conversations and activations on hepatitis and liver cancer. And alongside this webinar, we have developed a briefing for advocates, which we will share with the recording. And it includes a number of calls to action. I'm just going to give you a very quick sneak peek, and I do mean very quick, of the 4 calls to action that we have included as part of this that I think we can all come together to deliver. And so it's really around raising awareness that hepatitis vaccination, testing and treatment must be integrated in national cancer prevention programs. Countries must invest now, and people living with hepatitis must have access to affordable and accessible treatment and monitoring. And I think if together we can achieve these, we'll make huge impact. So finally, I want to wish everyone a very successful World Hepatitis Day tomorrow. Thank you all for being with us. HEP can't wait.